I've always been a very healthy person until probably about 6 or 7 years ago. Quite suddenly I was diagnosed with MS. We're both healthy and then your roles change, you know, and then he was retiring and it was all suddenly we were home. And if you're ill, then it's a really hard thing because, you know, you're not independent anymore, you're relying on somebody.
I was bouncing around the NHS system going to see. I was a doctor shopper, I was a therapy shopper, I was looking for the cure. I was in a pretty desperate state really because the pain was managing me rather than me managing the pain.
My interactions with my son were more along the lines of, you know, well, you've got to do this, and if you don't do this, you can't have your toys. It would end up in a lot of arguments. You know, it doesn't work for me to just say to him, well, you're going to do your nebuliser and you're going to do it now, and there's no, you know, I'm not arguing with you. That approach just doesn't work, and it never has worked.
It is about collaboration.
The second one, which is 2.
I know as a GP, and we all know, that patients come back again and again and again, and clinicians sometimes feel stuck and don't know how to engage people in their own health. And also, from the patient's perspective, sometimes they don't feel listened to and heard and empowered. So I think both sides, we need to do something around the conversation.
Things are so impersonalised.
I was lucky to attend a pain management programme, and what it gave me was a confidence and skills to actually self-manage my pain myself.
Health coaching gives patients power, motivation. It gives them a kind of eureka moment. Sometimes it's like a light bulb going off and all of a sudden the penny drops, everything just makes sense, and they've come up with this solution on their own and they leave feeling good about themselves, not feeling like they've just been given a set of instructions from yet another professional.
It's put me back in the driving seat. Lots of people with long-term conditions, what happens is that the healthcare provider actually takes people out of the driving seat, puts them in the passenger seat, and they just take us around on a little journey around the NHS.
I was initially sceptical of health coaching from the beginning for several reasons. Health coaching was new jargon, I didn't understand it, and on the surface, health coaching seemed to be potentially at odds, at friction with professional identity and our duty of care as doctors.
The GP was providing me with lots of the answers about my medication or my treatment. But with the health coach, it really was about me coming up with the solutions to things that I'd identified that were important. And then during that time, she also helped me look for resources that would be available in the community, online, all sorts of different types of resources that might help me get back to walking.
It's about an adult-to-adult conversation, which sounds obvious, but I think we're used to in this medical model of talking down to patients a little bit. We are the professionals and we know it all, and this is about identifying that patients are their experts in their own world.
The negotiations about getting it done are much more relaxed, much less stressful, and he's able to talk about how he can manage his condition himself. And he's started to set himself goals which contribute to his well-being. I really feel like there's much more respect between us, and I feel we get on so much better because of it.
This isn't about a change of mindset only for professionals or only for patients. We all need to change the way we think about health.
People really go away and change the way they live from a very simple intervention, perhaps no more than 10 minutes with one practitioner.
We need to change what we do and make hospitals as much a place of health as sickness. One of the things that we've done this year is train up 2 health coaches to train over 200 staff to help and support those staff have different conversations that will support our patients and deliver better patient experience, better quality and better outcomes.
By the time patients arrive, they're already more engaged, they're more motivated, they're looking to make positive change. And in the long run, that's going to decrease the burden on NHS staff, and it's going to empower patients as well.
Now, with my deepened understanding of health coaching, I see that it is and can make me a better doctor by bringing me back to what I really love about my job, and that's people.
The process gave me myself back. I started seeing myself as a person again, rather than just somebody who was ill or disabled. And yes, I still have medical problems. I know that there are things that won't change and maybe in the future may get worse. But it's given me the confidence to know that I can develop skills to get over those or to cope with them in the future.